بسم الله الحمد لله والصلاة والسلام على رسول الله. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. The morning message for today, right about Gaza. Every now and then we come back to speak about Gaza, to remind of our duties towards Gaza, of the situation, the current situation, raising awareness, helping, supporting every single person, every single human, not every single Muslim only, every single human should be concerned about what's happening in Gaza, in Palestine, and should try to help to the best of ability, whether it is raising awareness, whether it is supporting with money, supporting with food, medical, whatever you can to help our brothers and sisters in Gaza who are suffering and starving currently as we talk. Speaking about the medical situation, Alhamdulillah, some of the delegations of doctors managed to enter to Gaza and to come out of Gaza, and we hosted our dear brother Dr. Ahmed Sayyid before. He's one of the doctors who managed to get into Gaza and see the situation on the ground and come out after that. Alhamdulillah, now he's out and he can tell us about his experience and to also put you into the picture of what's really happening there in Gaza currently as we talk, so that we can raise awareness and at the same time we can support to the best of our abilities, inshallah. Dr. Ahmed Sayyid joining us from London. Assalamu alaikum wa rahmatullah, Dr. Ahmed.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you for having me again after a year and a half. When I first visited Gaza, you also gratefully hosted me. Jazakumullah khair.
Jazakallah khairan. This is the least we can do. The least we can do is to raise awareness, and you are doing great work. Allah subhanahu wa ta'ala reward you and bless you. Dr. Ahmed, in the beginning, just tell us about your experience in Gaza the first time and now, and what is the current situation, if you may speak for a while and put the viewers in picture, inshallah.
Jazakumullah khair. So I'm a chest surgeon. I deal with injuries to the chest. I have, alhamdulillah, been blessed by Allah Azza wa Jal to visit Gaza 3 times during this war. The first time was in January 2024, and that was one of the first missions that entered Gaza. And at that time, the intention was carpet bombing of Gaza with F-16 bombs. F-16 bombs are way over a ton, and they were being deployed onto Gaza every few minutes, day and night. And the injuries at that time were buildings collapsing, and whoever is buried under the rubble never comes out. Those that are on the surface would come to the emergency department, and most of those would be dead. Some of them would be alive. The injuries that would affect the limbs were usually amputated by the massive crushes, but those that affected the head, chest, or belly, usually those were fatal, and the patients would not make it. That was the first visit. In my second visit, which was December 2024, the last visit before the ceasefire 7-8 months ago, I was in the south, deployed to the south, and if you may recall at that time, the borders of Netzarim, which splits Gaza into north and half, was completely closed, and the north was they tried to annex it. So severe hunger, severe explosions and damages and injuries. At that time, because I was in the south, I rarely saw these injuries because they couldn't pass the borders. It was very, very difficult. And I spent my time over there with neglected cancer cases and neglected disorders from the start of the war. And then the ceasefire started. And in March, as you know, Sheikh Samih, that the ceasefire was broken by the IDF. And this time, the injuries are very different. So all the humanitarian aids and tikiyas and distributions of food have been closed except for 4 centers. These 4 centers are the American Gaza Humanitarian Foundations, GHFs. 3 of them are in the south, bordering Rafah, and 1 is in the center in Deir el-Balah. The one in the center is where I was deployed. I was deployed in a hospital called Shuhada al-Aqsa, which is in the center. And I spent there a couple of weeks last month, a couple of weeks in July.
Mhm.
And the injuries were mainly organized in collecting the people to enter and take whatever the food is distributed, which is hardly anything. And on their way out, the defense around the food distribution are IDF. They basically were bombing and fire bulleting with live bullets those who would leave the food collections. So at the time of the distributions, we would see swarms of casualties enter the emergency department. And in Shuhada al-Aqsa, which is not a large hospital, we would see between 200 and 500 casualties daily. Between 200 and 500 casualties daily. A lot of these were designed to kill. They're not designed to scare. They're not designed to organize any lines. They're designed to kill. And so that was the main issue. So one of the cases, for example, that one of the nights that I was there, I was attended to 3 major chest casualties at the same time. Major chest casualties at the same time. The first was a professor in neurology who had bled 2 liters, which is about 1/3 of his blood volume, down the drain. He was still speaking. He still had his blood pressure. The second patient was a patient that couldn't talk, that was hardly breathing, on 100% oxygen, not maintaining his oxygen levels. The third patient was a 14-year-old Abdullah who had again drained about 2 liters, which is about 90% of his blood volume. His pressures are hardly readable. He's about to die. He's unconscious, brought in by his parents because there's no ambulances. There's no one to bring the patients, and sometimes even the relatives have died, and the patients are brought in, or the casualties are brought in through bypassers. So in that situation, with all these injuries, it's very difficult to manage them. SubhanAllah. The first patient was managed with blood transfusion and other measures. The second patient, I managed to wrap him and externally fixate his crushed ribs, which was preventing him from breathing. The third patient, who was 14 years of age, Abdullah, I took him straight to theaters, and because there was hardly any blood in his system, I opened skin down to bone without any bleeding, because there's no blood left, and his heart is about to stop. Trying to get through to the heart to stitch the hole in the heart from the shrapnels that went in through his right chest, we did not have the proper equipment. We did not have the appropriate equipment. And because time was not on our side, I had to open his chest with an orthopedic chisel, hammer and chisel, which is not right, basically. This is not right.
Mhm.
On entering the chest, his heart was stopping. Halas, I had to hold his heart in my hands and do internal compressions until, alhamdulillah, with the blood going in and with the internal compressions, his heart regained the beats, and we identified the hole in the heart and stitched it, and alhamdulillah, he survived. And alhamdulillah, all 3 patients survived. But a lot of other patients didn't.
Mhm.
A lot of other patients didn't survive, brother.
Mhm. Dr. Ahmed, we speaking, and as you're talking, subhanAllah, I just came to my mind. You are a champion. You are indeed a hero. May Allah subhanahu wa ta'ala reward you for all your efforts. And all those who are like you, I'm sure there are many champions in the forefront, and there are many champions also in these hospitals which lack any equipment at all. And I just want to ask you a question just to put the viewers into the picture more. Is you visited 3 times, as you're saying. What was the difference each time you visited? When you visited the first time, what is the difference now? Second time, third time? What were the observed differences when it comes to what you've seen, not only in the hospital, but even outside?
So the attempt here is to completely destroy the whole of Gaza and destroy any feature of humanity, destroy any living organism. Whether it be by carpet bombing, which I saw in January 2024, whether it be by complete annexing of the north and trying to bombard one part and completely stop any feed and destroy part by part, or whether it be even now by collecting crowds from the hunger and then firing at them with bombs. 80% of the damaging I saw and the injuries I saw were shrapnels and explosive injuries. Brother, Abdullah Samak was one of the people that came to us after a bomb came, and he was very close to the center. 2 of his sons died on the spot. 1 of his limbs flew off on the spot, auto-amputated, and he came in with cracks and fractures to the chest, to the ribs. The underlying lung was massively lacerated. The spleen exploded. Both limbs were damaged, one of them amputated in the field, as I told you. He needed extensive surgeries over the course of 12 hours between general surgeons, thoracic surgeons, and orthopedic surgeons. And unfortunately, after a couple of days, he did not make it. And some of the patients, brother, from the extent of the damage, because the resources are so limited, we have to make the difficult decision to leave a patient die, because with those resources, we could save 2 or 3 patients. So we had to make that decision. For example, Ibrahim al-Noor came in after a crush injury where his ribs were completely crushed in the front, his airway was burst, and all these are things that can be fixed, but they will need a lot of care, a lot of resources. We don't have those resources. We have hardly any ITU beds left, which are even very limited in resources. The ITU beds are limited in resources, let alone the numbers. So we had to leave him, and he passed away after 12 hours.
So this is intentional destruction of the medical features in Gaza and hospitals in Gaza in order to eradicate the people of Gaza and kill them. Allah subhanahu wa ta'ala accept them as shuhada, as martyrs, and may Allah Azza wa Jal help those who are still alive. And just after the break, Dr. Ahmed, we will continue to speak, inshallah. Just allow us for a short break. We'll come back thereafter, inshallah.
Inshallah.
Bismillah, alhamdulillah, wa salatu wa salamu ala rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. We continue our discussion and our talk with Dr. Ahmed Sayyid, one of the champions, one of the doctors who managed to get into Gaza 3 times and support the people of Gaza and medicate them, among another delegation. May Allah subhanahu wa ta'ala accept from him and from all those behind the scenes, and may Allah Azza wa Jal accept the shuhada of Gaza, and may Allah subhanahu wa ta'ala ease the difficulties and remove this ghumma, remove this trouble, and grant victory to our brothers and sisters in Palestine. And may Allah use us for that. Allahumma ameen ya Rabbal Alameen. Dr. Ahmed is speaking about the medical condition of Gaza generally and hospitals there. And subhanAllah, as you can see, the doctor is even mentioning the names of the patients. And this shows how it is engraved in his heart. These memories, it will never be wiped away. And again, this emphasizes on the point that every single Muslim should do whatever whatever in his or her capacity to support our brothers and sisters in Gaza, whether it's raising awareness, whether it's donating, whether it's medical support, whatever you can. Coming back to Dr. Ahmed, Dr. Ahmed, you've mentioned the issue of the lack of medical tools, etc. Perhaps what we should mention also is about the number of hospitals that is currently working in Gaza. I believe Gaza had so many hospitals but get destroyed. If you can just tell us about that.
Okay, so in the north of Gaza, there used to be two major hospitals, the Indonesian and Shifa hospital. These are completely out of function and they are completely destroyed. Next to them are a few other centers, but they are not equipped to do any major surgeries or trauma surgeries. In the central region, there is Shuhada al-Aqsa, which I was deployed to. This is originally a small hospital, mainly developed for deliveries, babies, and midwives. However, due to the war, the two theater suites that were there are now trauma suites, 24/7. Trauma suites, 24/7. The Turkish ministry has built a floor for orthopedic procedures in above the hospital, and it is being used. It's not well equipped. It cannot be used in full power, just in partial power, due to not the lack of equipment in itself, but due to the lack of nursing staff. Most of the nurses have died, and there's hardly any nurses left. In the south, there are two hospitals, one called the European Hospital and one called Nasser, and there's a third, but that's completely destroyed, which is Al-Najjar. Nasser is currently the only hospital functioning in the south, and it is the major center functioning. It is not a big hospital, but it is what is available. It is usually from time to time bombarded, and a lot of the patients during my 2 weeks would have to come from the south to the central region, walking 10 kilometers, while carried by their relatives because they couldn't get to Nasser. The European hospital has not been destroyed, but the IDF has put it out of function and has taken it over. They're living inside it. They're currently living inside it.
Mm-hmm. The policy of the Zionist army in destroying the hospitals and the medical facilities is clear, but I would like to hear it from you. Why do you think they are destroying these hospitals and bombarding them?
So when a bomb drops, brother Samih, a few people in the center will die, but a lot of people around the center will have shrapnels go through their chest, their head, their limbs, their bellies, and these are injuries that can survive, and if not dealt with in a timely manner, they die. So by destroying these hospitals, a lot more damage, mortalities, permanent disabilities will happen from the blast injuries that they deploy.
And as a medical doctor, we would like to hear from you. You mentioned the lack of equipment. What are, in your opinion, what are the most important equipment that the hospitals in Gaza are in need of?
So obviously the lack is beyond description. Everything is lacking. Yeah, we're now coming up to 2 years after the war. So when we talk about sutures, when we talk about sternal saws, when we talk about massive amounts of equipment are missing, and we expect that. So going into Gaza, we're only allowed to carry what we can with our hands. Yeah. Alhamdulillah, with the help of my colleagues, I managed to get in 5 bags. 5 bags, alhamdulillah. And it had what it had. We try to contact before we go in our brothers and sisters inside the hospitals and see what exactly is the most needed, and we know what we will use, and we try to bring it in with us. But there's only so much I can carry, and there's only so many missions that go in at one time, and many are cancelled by the Koga and the IDF last minute. Many
from which crossing you entered, Dr. Ahmed?
So this time it was through Amman, through the Allenby Bridge. You take off from Amman in a 15-hour journey, which ideally shouldn't last more than 3 hours. And you just carry what you can, going through the Allenby Bridge, through the IDF borders, the West Bank borders, and then going down south towards Karam Shalom, Karam Abu Salim, and entering into Gaza.
Mhm. Were there any difficulties or obstacles on your way as you're getting in, and maybe if some other doctors wish to enter, is it allowed? Are they able to enter and support on their own risk?
No one can enter without being properly investigated through UN missions that hand over the lists to the Kogai, the Israeli Kogai, and this is checked. You may be turned down for no reason. The turn down is usually the night before the travel. So people come from Canada, for example, and halfway through, not halfway, after they arrive, only the night before deployment from Amman, they get turned down. And that's the way they do it. And they do it deliberately last minute. How they check you varies from documentation, from social media, from different ways. And they may just turn you down because you've been there more than once or 3 times or more for no good reason, even if you're silent on the social media. But one thing I need to mention before we end is what's worse than the casualties this time. The hunger, brother Samih, is worse than all these bombings and bullets. The hunger does not spare anyone. The hunger does not spare anyone. And that's what they know. And that's what they want. And the fact that they're seeing people drop dead is exactly the final target. When a person goes into starvation, it happens over weeks. Your body eats up all its reserves, and then it starts to eat itself up. It starts to eat its muscles up. And that's why you see people skin on bone. And then the heart stops functioning, and then they drop dead. Now, this is not an overnight event. This is long term. These people have been starved since March. They have not seen any fruit. They have not seen any proper food. Infections are massive. If anyone gets infected, the infection just seeps through because of the immunocompromise, and they end up dead for simple bouts of flu and common cold. The wounds that I operated on 5-6 weeks ago, some of them have healed, a lot of them haven't, and they don't want to heal because there's no nourishment. How can it heal if there's no proteins in the body? If I can't maintain my basic metabolic demands, then the additional demands of a wound healing will never happen. So yes, I might have saved some patients from bullets and shrapnels, but then they need the wounds, the cracked chests, to heal. And it's becoming more and more difficult. Actually, it's becoming impossible. And what's worrying me even more is that in August, a lot of missions have been cancelled. And after the talk of Steve Witkoff that there's no hunger, I'm very concerned of what they're hiding to happen during the month of August. There's something very ambiguous going on. These doctors, when they go in, they are witnesses on what's happening.
And you've witnessed what happened, and you related this to us. And perhaps I would like to, at the end, to give a message to, not to the government now, just to the ummah who's listening to you right now, to the people, to the human beings all over the world who are listening to you right now. What do you say to them?
So Allah Azza wa Jal can save the Masjid al-Aqsa, and he can save our brothers from Gaza in Gaza by kun fayakun. He doesn't need us at all. Yeah, we are the ones that need to be part of this.
Indeed.
We are the ones who will be asked and questioned on the Day of Judgment. You've seen your brothers starve. You've seen your brothers shot by bullets. You've seen all this happen. What have you done? And when you're being asked, you're asked on your own. No one will support you. no one will defend you. And it's either hell or heaven.
La ilaha illallah.
So
La
be
ilaha.
prepared.
Powerful and short and brief and to the point. Jazakallah khairan, Dr. Ahmed Said, for that. And this question we will ask it to every single viewer who's watching us right now. What have you done for your brothers and sisters in Palestine? Jazakallah khairan, Dr. Ahmed. Shukran jazilan for joining us. Barakallah fikum. استودعكم الله. طيب, this is the question that Dr. Ahmed raised, and a lot of people raising all over the world, and we are raising, and we need to take some action. What have you done for your brothers and sisters in Palestine, especially in what Dr. Ahmed mentioned, what is more worse than the bombing, and that is hunger. And sometimes people say, oh, if I'm donating something, if I'm giving something, maybe it's not going to reach. And we've mentioned to you before that there are many organizations that are working on the ground in Gaza. Many charitable organizations working on the ground in Gaza, trying to secure from inside, from the resources inside, the very little limited resources inside, what can nourish the people of Gaza to a certain extent. So if you can support such organizations like that, please feel free to contact and to support and to say, Bismillah, this is what I'm going to give to for one pot of food or for water tanks or for this or for that. Let us all do something, ikhwa. Get together as families and support. في سبيل الله. قال صلى الله عليه وسلم اتقوا النار ولو بشق تمرة. Put between yourself and the fire of Jahannam wiqaya, a protection, even if it is half a date. Even if it's half a date that you give في سبيل الله. The most important charity is where it's giving to the most important people. The most valuable charity is giving to the most needy people, the most people who are worthy of it. And I cannot think of people on our planet more worthy than your brothers and sisters in Gaza. And you've heard it from Dr. Ahmed Said about the situation there in Gaza. So give generously, support to the best of your ability, raise awareness, and ask Allah subhanahu wa ta'ala to accept and to forgive our taqsir and to accept our sadaqat and to accept whatever we're going to give fi sabilillahi azza wa jal, hoping that we will be shuraka, we will be partner with them in their journey to freedom. We ask Allah subhanahu wa ta'ala to grant all those people who are supporting and helping, grant them khalafan. Allahumma a'ti munfiqan khalafan. Ya Allah, give those who spend, give them more. And Ya Allah azza wa jal, grant, we ask Allah to give victory to our brothers and sisters in Palestine. Ameen, ameen, Ya Rabbal Alameen. We're going to be taking a short break. We're coming back inshallah after the break. Stay with us.